and want to thank Teresa Hudson and the UAMS team, Michael Cuccier. They are doing the needs assessment process, and so they have been hard at work developing questions and pulling all of that together. So that is in the works as an update. So wanted to give you all, and then want to ask anybody else on that committee have anything to add. I know we've been going over our goals and objectives, getting ourselves organized, getting a regular meeting cadence, doing the needs assessment piece. As I say that, that's a lot. So I wanted just to know if anybody on that committee wants to add anything.
Kim, one clarification, it's the second Monday of the month. Not the third, it's the second Monday. So, and we will be sending out an agenda for, excuse me. We will send out an agenda probably later today. I have it almost ready, so that everybody will kind of have a heads up about Monday. And it seemed like there was one more thing I wanted to tell you. I guess there were just two things. So,
well, no, thank you, Teresa. And thank you for organizing us.
Oh, I know what I was going to say. If you'll forgive me for hogging the time.
Sure.
I've asked Jeff Pine. Many of you know Dr. Jeffrey Pine. He's a psychiatrist that I believe works with Dr. Ward Jones's group. And he's also on faculty at UAMS. And he's a psychiatrist that participated he was one of the PIs for a number of projects that examined collaborative care and how to, the advantages, was it safe, et cetera, and also how to implement it. I've asked him to join us and talk with us about how it differs from other models of care and how what it takes to move toward that model. Because we all, we are a resource challenged environment. And so we're having to do what we can to make behavioral health available. And so I've asked him to talk with us about how collaborative care model is different than other methods of integrated care and how we move toward that and what are some things to think about it. Because we're somewhat resource rich right now, and we have the ability to harness some resources. And so I thought it would be good if we just had a discussion around that. And so that will be the bulk of Monday's meeting. I'll give a small bit of information about some of these other findings we have with the needs assessment and so on that we were doing. But we're going to spend the bulk of the time thinking about what this model really is and how do we move toward it.
That's exciting. Oh, I can't wait for Monday. Awesome. Thank you. And thanks for organizing that. Another piece, another announcement I just wanted to let you all know. Yesterday on the ABIN monthly webinar, we had a CoCM webinar. The focus was CoCM for perinatal patients. And we had a phenomenal team out of the University of Michigan. We had a CoCM lead trainer for the PRISM Institute, and we had an OB-GYN who absolutely was just phenomenal. I was blown away by her outcomes for the pilot project that she showed. And to speak to her dedication, she was in Austria, zooming in to provide this information to us. And she was so passionate and so committed to how the CoCM model could be effective with perinatal patients, and her outcomes were unbelievable. Yes, there is a recording, And that recording will be on our website. Hopefully, I'm going to say give myself till Tuesday. They've already sent us their slides. So I'm glad you liked it, Bree. Good. Yeah, she really was impressive. Nicole was on. We had a few people from the team on, and I thought she did an amazing job. And it really started me to help me think about I'll think a little bit out of the box on what some of these CoCM programs could look like and with specific populations. And, sometimes I think we get really excited and we think, gosh, we're going to do this. But if we could narrow this down and maybe start with a small specific population and get that going, sometimes that can be helpful before we spread this. I know I've heard Verna talk, maybe you pick a population, maybe you're thinking about depressive patients or perinatal patients or anyway, so wanted to say it's if you haven't seen it, I think it's worth your time. I'm probably going to watch it at least once or twice more because there was so much good information on there. So and another thing, that we're thinking about as we're bringing in some of these trainers and some of these recordings, we're going to, have all of these pieces available on the website. So if someone said, gosh, I really want to do CoCM with a perinatal population, but I, need to get some ideas and I want to see how I could get started, that could be a great resource. So we will be putting that on.
Hey, Kim,
Yeah,
I'll throw out one idea, thinking through that population. If you have a high risk population, mothers that by either age or medical condition have been told that they're more likely to have issues with their pregnancy, I'm thinking that would create an awfully defined population of individuals with anxiety, if not possibly even some additional issues with depression. If a mother's been told that her baby might have a deformity of some sort, or they're being followed by a high-risk clinic. And I know UAMS even has that telemedicine high-risk clinic where they bring geneticists in and different things like that. But I'm just thinking of that population as a limited target versus just the general population of mothers to be.
absolutely. That's such a great idea, Dr. Jansen. And Verna, I see you're putting something in the chat. Thank you for that resource. Reduction of anxiety symptoms among women within a collaborative care model in women's health settings. It's published, looks like this review. So there you go. Awesome. But to follow up with that, Dr. Jansen, I think that, especially as we start moving and growing CoCM in Arkansas, it might be that programs say, hey, I'm going to start with this small population. And once I start to address this population through screenings and keeping track of them on a registry and seeing if with consultations we see improvement, that might be a way to start small with a defined population and then spread. So
One other defined population, mothers with history of SUD.
yeah, those are great ideas. So in addition to the webinar that we had yesterday, just a quick update, some things that we have done. We have met with Eastern Arkansas, and we have met with Boston Mountain. We've developed a readiness assessment tool, and we've given those to both Eastern Arkansas and Boston Mountain. We'll be receiving those later this week, and we will be providing our first foundational CoCM training for this project. It'll be one of 3. It'll be on the 14th. we'll do one in May, one in June, and one in July. And I know Verna's on, and Verna will be our person providing the training. So thank you, Verna. We are so excited that you're going to be doing that. And then Caitlin has been in the process of scheduling our individual calls. And we'll start those monthly calls the first part of June. So that is our update. Feels like a lot's been going on in CoCM. And then I wanted to, and I'll talk about this in a minute, but want to pause here. And I don't know if David Jones is on. And David, if you have an update you'd like to give. I don't see he's on. Saw an iPhone, but didn't know if that was David. So, all right. With that, I'll pass it over to Tisha and ask Tisha if she wants to give some updates from the UAMS end.
Thank you. And before I jump into UAMS, I did, think for this team and, as we're thinking about sustainability, one of the interesting things about the presentation on Thursday was that that program is funded through DHS. So it's not a fee-based service. It's something that DHS pays for and that they don't bill. It's also something that they're trying to codify into legislation, that it's part of the Department of Human Services programs for patients, for women, and for those who just had a baby. So I think that is an important thing to think about, is that other states are outright funding these programs because they're so effective. As a UAMS update, we have had some exciting developments. We have completed interviews for 2 behavioral health care managers, and I just today informed 2 of them that we'd like to move forward with their application. So we're in the process of reviewing references and getting offers to them. So hopefully in the next 6 weeks, we will have 2 new behavioral health care managers to support our collaborative care teams. So we're really excited about that. We have been limping along, as most people who implement know, by having our behavioral health consultants do the dual role. We know that that's really difficult, and so we feel like this is really going to help us to really increase the number of patients that we're able to see. So that is our biggest news. We also are moving forward with our project to build the registry in Epic, and we are I'm trying to get a meeting with the big Epic to talk about whether using the behavioral health module could be helpful. And so we're working on that project, but it's definitely in the middle of the works. So those are our 2 big updates. I'm happy to answer any questions that people have.
That's awesome. And Tisha, I'm so glad that you, I'm glad that you've got these folks, you're getting ready to bring them on. It sounds like the program's moving ahead, but as far as talking about the payment for that perinatal program in Michigan, the state paying for that, I wanted to say Verna has sent Verna, I just have to say thank you, because I find myself referencing, and Verna sent us, because Verna is on top of what's happening in all of the national research and information. But Verna did send us, and we will include the link with the meeting notes. She sent us a brief titled "Mounting Evidence That Use of the Collaborative Care Model Reduces Total Healthcare Costs" from the Bowman Foundation, Family Foundation.
Tisha shared it a little while ago as well.
Oh, perfect.
Yeah.
Thank you, Tisha. But one of the things that I saw, and I'm sure you saw, Tisha, is that one of the things they're doing is they're encouraging that the reimbursement I see here for is at least 30% above Medicare rates. And so as I'm holding this, I'm thinking about, as we're talking about turning on codes and what that's going to look like in Arkansas, for us to be aware that that's something, we heard from North Carolina. They said it was challenging to have uptick when codes were not higher than 100% of Medicare. They advocated, and so now they're at 120%. So there's something for
Yeah.
us to be aware of as we're moving forward. And
Here's the problem though, and we're actually doing some advocacy in North Carolina, and I would think about it in all of the states, is that the advocacy, so if Medicaid is 120% of Medicare, 130% of Medicare, then that should be the floor for all plans in the state. So in other words, that the commercial plans in the state, because Medicaid is usually the floor, right, for sort of the guidance for the state. And so that the commercial plans need to then match those rates. And so what's happening, like in North Carolina, even though Medicaid is good, right? Because the commercial plans, that's not even a word, but but because the commercial plans actually pay so low, well below Medicare for a lot of the smaller practices, it actually still is problematic because then they're barely at Medicare. And so that actually is an issue. And so as you go forward to think about it, not only do we want Medicaid to be there, but we want to tell the commercial plans, you've got to match us in the state of Arkansas.
yeah, now, those are all great. And I'm very grateful because as we're talking to each other, to the state, information such as this brief is helpful, gives us some information at our fingertips that we can show. So, and I know Tisha is active as the legislative representative for the APA in Arkansas. So,
and we should the work group for mental health in Arkansas, the legislative work group, should be reconvening soon. They said after the fiscal session, so Mayish. It's May now, so hopefully in the next month or so they will reconvene, and that's something that is really important to be attending and talking to the legislators about what we need.
absolutely, we probably should send them this brief so they're aware. And
I sent the email to everyone who's on the list for this call.
Okay.
So I think Kim Hammer and
Deanne,
Representative Bott is on there. So
awesome.
can't hurt to send more. Send again to by more people.
Yes. Right. It looks like Dr. Gibson shared Arkansas Blue Cross Blue Shield has been covering the CoCM codes and has a new payment policy, and she shared the link for that new payment policy. Awesome.
I don't know what the specific percentage reimbursement rate is, but you're reminding me to find out. But Blue Cross has been covering for the last few years and actually was helpful in getting the legislation passed for the act. And in the past, they have not had specific payment policies, but this behavioral health integration policy is one of the first that was developed, and it is modeled very specifically around the MLN for CoCM, to be sure that people do understand what the model is and that people are billing the codes appropriately. So I was really glad to see that the policy team did that.
That's awesome. Thank you for sharing that and for working on getting that developed. That's a huge piece.
Well, it was interesting to me. We got a bunch of emails whenever the policy came out about the 90984 code, about that it was only being reimbursed under the primary care provider. And people were like alarmed, and I read it and I was like, no, that's how it's supposed to be reimbursed. So it's not a change or a problem.
I think it does have the codes that pay social workers and psychologists. I don't remember what that code is. Is it a G code?
Possibly. But all of them are still, they're reimbursed under the primary care provider.
Okay. And then one of the things, and Tisha, I'm going to ask you to help because I think you coordinated the registry webinar for CFHA. CFHA did a fantastic webinar on registries. Just, I can't remember if it was last week or the week before. Sorry, the days start running together, and I can't remember if we're on the second or third Monday. But anyway,
It was last week.
last week. Okay. And I thought that they did a fantastic job really talking about a lot of the because one of the things we're doing is when we're starting to get CoCM together and implemented in sites in Arkansas, we're talking about, well, do we need a registry, and what type of registry do we need, and what will the components be? And so they really touched on that last week a little bit. We had Vija, and I can never say Vija's last name, Vija Santajov, and his organization that he's saying he identified it as Akello, and he's been working on the CFHA website. I see him on there all the time talking about what are the components needed to make a registry. And so he was able to talk about where he is with his work. They had the AIM Center, and they did a presentation and shared a link to a video demonstration for the AIMS registry. They had Mira Health, and they did a short demonstration and showed theirs and the different components they had, as well as the Hartford, and showed what they have built, what they're using. And then they shared the name of a freelance person who helped them build their registry, and he's now out on his own. And so we grabbed that freelance email, thinking that might be a contact for some of us if, because I know there's individuals who are wanting to build their own registry. So wanted to pause there, and I don't know, Tisha, if you want to talk a little bit more about thoughts, or as you're organizing this, are you seeing people are struggling finding a registry that works, or any thoughts you might have?
Yeah, so I put a link to the CFHA Collaborative Care Special Interest Group page on the in the chat, and there are recordings for the meetings that have happened since we became a SIG, which is about a year now. So that's not on there yet, but it will be on there whenever they get it edited and posted. And yeah, so really what we wanted to do was just kind of give our special interest group members an overview of some of the different registries that were being built and used, and allow for time for question and answer about the different ones. I think it was a great discussion. We had kind of a startup with Akello, which is really kind of just starting, and it's very kind of open source and kind of build your own kind of program. And you've got the AIM Center, which was developed for research and is really kind of, it's very specific to collaborative care, and it's kind of like this is what you use, but it's well supported, but it doesn't interface with your electronic health record. And then the other ones were like, I can't remember, Ben Hilliard's group, Mira. Theirs is really based on being open and having lots of different ways to measure things. So they have tons of measures that you can build into and what you're trying to kind of screen for and track. So they're a lot more flexible.
Didn't you say like about 450 or something? I was like, wow.
Yeah. They were started in specialty mental health as like measurement-based care, and then moved into the collaborative care space, as it's what it seemed to me. And then the Hartford Health built their registry in Epic, and it has a great, she demonstrated some of the screenshots of some of the reports that they built and how they use that in Epic. And then she had shared her contact for the person who helped build that in Epic. So great information, really helpful, especially, for our teams as we're trying to think through what we want to do. Like, we know at UAMS, we want to build our registry in Epic, and we currently use the AIM Center. But as other team members and people in Arkansas are, different clinics and groups in Arkansas that could be a good resource for them just to kind of explore different options. And as a plug, we are working on, hopefully in June, but if we can't get it together in June, then another month, having the groups like Concert Health that are more comprehensive. They don't provide standalone registries, but provide staff and support and integrate with you through bringing in team members to implement collaborative care.
So the turnkey solution.
The turnkey solution. I love it. So we're going to have Berna will come and talk, and then we'll have a few other groups that do that come in. And so it'll be a similar kind of panel discussion, but in the more of the turnkey. And you can add.
Yeah, I've also been thinking a lot about this, and I say it, obviously with a concert hat, but also wanting to move collaborative care and have people find what works, right? And so I think there's some real differences that are arising in, I'm going to call them clinical partners and not vendors. But there are, like, Ascend really specializes in working with the FQHCs, right? And they also do psychiatric care and that, whereas Concert is more of the bigger health systems, like a rollout across some of the larger, versus like one that does oncology now, right? And so I think there's some really key questions. Like, I tell organizations, do a request for proposals. Here's some things you can ask. What's the background and licensure of the care managers? What is the training? Where do you stray from the fidelity of the model? What populations? What are your care pathways and outcomes? So that people can really make informed decisions when they're choosing a clinical partner. And so it might be helpful when you think about putting that together, like some specific questions that people could sort of answer to really help people understand what some of the differences are, or what some of the considerations should be if they're thinking about a partnership, if that makes sense.
Yes. Absolutely. And I love that idea of the turnkey, right? The turnkey solution. All right. Okay. And one of the things we wanted to show is, so as we were just getting started down this CoCM pathway with this project, And so we were asked by our partner, actually Boston Mountain said, well, hey, what are some of these components that are needed for the registry? And so what we did is we got together with Dr. Sideri and we said, hey, could we pull something together to show what are these needed components? And so I'm going to try to share my screen and show you all. Well, let me pull it up, show you this that we did, just so that as we're thinking about what are the needed components, we have something to start with. So, and we're gonna share this with you all. And we've shared it with Boston Mountain, and we'll get it out to everybody after with today's minutes for the call. So it's really pulling together what are the registry components that could be, well, not could be, that are helpful to consider for the collaborative care model. And so Dr. Sideri has been working in this space for a long time, and we've been able to talk to her about registries that she's used and registries that her colleagues call her and say, I'm struggling with this or that. Here's my pain points. And so we pulled this together to look at what are some of the components, and we'll get this out to you all. And I know you guys, UAMS is working really, really hard on building, embedding their own registry within Epic. So that's an amazing feat. Tish has had to become a certified IT person to get this done, but you're doing it.
I had to well, for my own personal edification, I had to become a physician builder and do the training so I could communicate to my team what we felt like we needed. So I had to learn the language, and I'm still not sure if I know it, but we're getting there.
No, that's awesome. But wanted to show you all, we did pull this together. Julie, I sent this to Sadie yesterday. So you all have it because she had said Boston Mountain's going to build their own. And so,
Yeah, I found out this week that I'm gonna be building it.
oh, wow.
I may
Okay,
have lots of questions.
there you go. That's exciting. You're like, uh-oh. But anyway, so we've pulled this together because one of her questions was what are the needed components? One thing, and I think it's important for us to, well, first of all, do you all have any questions, or do you think that this could be a helpful resource?
This is really impressive. This looks really great. I mean, we could use this as well.
Awesome. We will get it over to you, Dr. Jones.
Okay.
One thing people say over and over is to somehow, if you can have built in that it's counting the minutes as opposed to, and so although I see in this, it says registry list sorting capabilities is by minutes. I was wondering if that was something, I think that's a challenge to get minute counter. But
We actually have that. We've inserted that into ours. So I don't think that's going to be a huge thing for us.
Yeah, we can do it as well in ours. I think you guys are on eClinical as well, too. Right. Okay.
We purchased the behavioral health module. And so we've we've built the whole thing pretty much from the ground up.
Yeah, we have that as well.
That's awesome. Look at you guys. You can count the minutes and we'll send over these components and that's fantastic. Um, all right. Any other thoughts on registries? I know that's kind of been a big topic and registries are an important piece of the collaborative care model. So, wanted to again reference and remind everyone, Tisha coordinated a registry demonstration, and I learned a lot. I think every time you work on a different EHR, there's always a learning curve. There's always pieces that you like, pieces that you don't like. When I've changed jobs and changed EHRs, I thought, oh, if I could only bring this functionality over. So anyway, we want to make this as painless as possible and know that a registry is a key component. So we'll be working to support you all with that. Okay. Thoughts or things we want to discuss? Anything CoCM related before we get to Caitlin's CoCM announcements? One thing I just have to say, and I was so excited because maybe this is a little bit of the nerd in me. As I was reading this Bowman Family Foundation brief, one of the things that they talked about is really we're at a crisis state in our country with trying to have enough resources to address the mental health, substance use issues of our country's population. And there's compelling evidence that the collaborative care model can extend those resources. And so the more and more compelling evidence we see, the more excited I am that we have this grant and that this project is an opportunity for us to provide and reach more patients through this model. So we'll get you this model. It has great numbers. It also has nice cost savings. And so anytime we can show cost savings, especially large cost savings, that's critical, especially as we're talking to, the state and payers and everybody involved. So that's my excitement, and I'll pause there. And if we don't have anything else, we'll have Caitlin give some updates, and then we can give you a few minutes back in your lunch hour.
Okay, yeah, I got it just as you said. We're going to transfer it over to Caitlin, so I came back. Okay, let me go over. I'm going to share my screen in just a second. I'm going to go over some just upcoming educational opportunities for CoCM. Let me see, make sure I'm on the right page. Okay. Just like Kim mentioned earlier in today's conversation, we had that webinar yesterday for the collaborative care management in perinatal settings. That actually is already up on our YouTube channel, and which I'm going to show you before we get off of here. So that'll be available for you to go and watch then. And I have to say, I've worked in integrated health for several years now, although kind of new to CoCM. But it was listening to them, you learn something new every time you listen to them. So like Kim said, I'm gonna have to go back and listen probably 1 or 2 more times to make sure I get everything from both of those presenters. So that is available on our YouTube, and then that should be on our website too. You can always access it by going to the AVEN network .org, and then you can access our upcoming webinars and our recording library. We have many things on social determinants of health, several other webinars on collaborative care. So it's kind of a treasure trove there. We do have one upcoming that is that's not about CoCM, but it's a conversation you have in it anyways, about SDOH. That is on the 30th. Kim and I will be presenting on SDOH strategies and addressing behavioral health needs within those strategies. So just FYI, keep that up on your radar. We will be posting about that and sending a link out. Let's see. Another opportunity, and Dr. Gibson, if I'm not doing it service, you let me know. But the Arkansas Psychiatric Society is having their annual conference on June 1st. There is a great agenda, which I don't know if it'll come up if I hit it. Can you guys see the agenda loading? Okay, good. Okay, awesome. This has got several instances of CoCM on it, and most notably Dr. Beecroft down there for CoCM for addiction. I plan on going to this. This just looks like so much good information, just really well-rounded. So wanted to give you guys a heads up on that June 1st conference. You are able to register for it now. You can go to the website you see up top to do so. And if I'm sure if you have questions, Dr. Gibson would be happy to answer those. And let's see here. Oh, there was Verna got off, so I was going to ask her to give us a little bit more information because I don't have a flyer for this. I'm not sure if you guys can see this, but there is an overdose safety planning for primary care providers opportunity coming up on May 16th and on May 23rd. And I can send out me or Misty will send out the meeting links for those. I have gone to a couple of Verna's overdose webinars, and they're great. So this could be a very good opportunity for your team to learn some of this information as well. Lastly, just kind of wanted to direct you guys over to our YouTube channel. We have got a couple of different things on there, but wanted to just remind you that we do have that recording up. It's about an hour long, and that is available to watch now. And I did shameless plug here, apologize, but we are talking about perinatal health and postpartum. We do have 2 podcast episodes. We launched a podcast about a month ago, and we do have 2 episodes coming up about postpartum mental health, one with Dr. Rogers and one with Dr. Manning at UAMS. And that should be released in the next week or so, we're hoping. And those are accredited for 1 CEU per episode. We also have one up right now that's on peer support specialists and stigma, which is also accredited for CEU. So you're welcome to pop those on while you're waiting in a car line or driving on the way to work and listen to those and be able to get a CEU for that. So just kind of wanted to let you guys know we've got a couple of different resources on our YouTube channel. All of our webinars are accessible on this channel as well, so you can access them from different points. I saw Dr. Gibson put in the chat that yes, there is a virtual option for the conference on June 1st. So in case you can't make it into Little Rock, you are welcome to watch it that way. And yes, we will send all these links out, Julie, for these learning opportunities. I don't think I'm missing anything, Kim. Anything I didn't mention?
No, that's a lot of updates. Thank you, Caitlin.
You're welcome.
All right. Well, thank you all for your time. We appreciate you being here. We're excited to be on this CoCM journey with you all. Please look at this Bowman Family Foundation. The evidence for CoCM is compelling, makes me so grateful we're doing this project. And thank you. We'll see you next month.